You've probably heard of cancer, or maybe even know someone who has had cancer. Yes, it's horrific. It is responsible for 8.2 million deaths in 2012, and the mortality rate is expected to rise by 70% over the next 2 decades. While there are some conventional ways to treat and eliminate cancer cells, such as surgery, radiation therapy, chemotherapy, cancer patients may suffer side effects like fatigue, headache, diarrhea, nausea, appetite loss, hair loss, rectal bleeding, and organ dysfunction. Ngpdt Medical Center, we offer you a safe, minimally invasive, and effective therapeutic modality to treat both early and advanced cancer. We call it the next-generation photodynamic therapy, also known as Ngpdt. Next-generation PDT is a treatment which utilizes light to destroy cancer tissues. It is a greatly improved and enhanced version of the existing FDA-approved photodynamic therapy, PDT. Ngpdt is a non-toxic cancer therapy that targets only cancer cells and is highly effective at treating the whole region around the tumor. The treatment of photodynamic therapy starts with the administration of a photosensitizing agent. Patients are given chlorophyll as the photosensitizing agent, a substance derived from plants, and is completely harmless and non-toxic. This agent selectively collects cancer tissue and accumulates and concentrates them inside rapidly growing cancer cells. Next, the patient is exposed to a specific wavelength of light in the specialized LDS light bed, which activates the Ngpdt agent on the cancer cells, releasing a highly energized free radical form of oxygen known as singlet oxygen to damage and destroy malignant cancer tissue, while leaving normal tissue unharmed. Let's have a look inside the body. When the patient drinks the agent travels around the body via the bloodstream and sticks onto the cancer cells and blood vessels that are feeding it. When the body is exposed to the light will activate the agent, which in turn creates a singlet oxygen as a lethal weapon to destroy the cancer cells. First, singlet oxygen molecules will cut off the blood vessels that are feeding the tumor. Then they will burst the cancer cells like balloons or break the cell walls and ooze out the cytoplasm. This will dehydrate and kill the cancer cells. We call that necrosis or apoptosis. When the cancer cells die, the immune system will be stimulated and begin to create killer cells to target the remaining cancer cells